Hi, I'm Joe Graydon.
I'm Terry Graydon. Welcome to this podcast of the People's Pharmacy, where we bring you the stories behind the health headlines.
This podcast is brought to you by Redix Industries, makers of Utterly Smooth Body Cream. 800-345-7339, on the web at uttercream.com.
In the People's Pharmacy Health Headlines, caffeine may be okay even for people with heart failure. For years, cardiologists have warned their heart patients to avoid caffeine. That's because they worried that caffeine would trigger irregular heart rhythms. A new randomized placebo-controlled study has found that this is unlikely. The researchers included 51 patients with chronic heart failure and gave them 5 doses of caffeine or placebo over the course of 5 hours. This resulted in a total dose of 500 milligrams of caffeine or 0 milligrams of caffeine for those who got the placebo. After a week of washout, the exercise was repeated. Patients who had gotten placebo were given caffeine and vice versa. During both sessions, patients had continuous electrocardiographic monitoring. There were no significant differences between the groups with respect to any type of arrhythmia. The exercise stress tests also revealed no differences. Based on these results, the investigators conclude, to date, there's no solid evidence to support the common recommendation to limit moderate caffeine consumption in patients at risk for arrhythmias.
Diet soda is supposed to help people lose weight, but recent research suggests that replacing diet drinks with water helps women with type 2 diabetes lose more weight. The study included 81 Iranian women who were trying to lose weight and accustomed to consuming diet drinks. The volunteers were randomly divided into 2 groups. One group was allowed to drink diet soda after lunch 5 times a week, while the other was asked to switch to water. They were not allowed diet beverages at any other time of day, and they were asked not to use artificial sweeteners in their tea or coffee. The 6-month program gradually increased the exercise of all the participants and held all of them to a reduced calorie diet. Both groups lost weight, but at the end of the study, those drinking water instead of diet soda had lost about 2.5 pounds more. Women drinking water also had more improvement in their insulin sensitivity. One researcher noted that these results raise the question of whether diet beverages are truly beneficial for people with diabetes.
When people need surgery to fix an abdominal hernia, the surgeon often uses a piece of mesh to strengthen the repair. Using this patch material reduced the likelihood that the hernia would return within 5 years and require a second operation. That good news is counterbalanced by a higher rate of complications in the surgeries using mesh. People receiving mesh had more bowel obstructions and perforations. They were also more likely to develop surgical site infections, late abdominal abscesses, fistulas, non-healing wounds, and chronic abdominal pain following surgery. The authors conclude that the benefits attributable to mesh are offset in part by mesh-related complications.
Curcumin is the active ingredient in the yellow spice turmeric. It has recognized antioxidant and anti-inflammatory activity. Preliminary research has suggested that it might also have antidepressant effects. A new study from Australia reinforces this conclusion. Investigators recruited 123 adults with major depressive disorder. The volunteers were randomized into 4 groups. In addition to placebo, they were given low-dose curcumin extract, high-dose curcumin extract, and a combination of curcumin and saffron extract. The study lasted for 3 months. People in the groups receiving curcumin had improvements in both depression and anxiety scores. Saffron did not make a significant difference. The researchers conclude that both low and high doses of curcumin are helpful, especially against atypical depression.
People who frequently suffer from migraine headaches are often told to avoid certain foods. Research suggests, however, that it's not necessarily the foods themselves that are the culprits, but rather the bacteria in the mouth that interact with certain trigger foods. Investigators at UC San Diego analyzed data from the American Gut Project, in which subjects provided samples of mouth bacteria and answered questions about their health. They found that those who reported suffering from migraines had more bacteria that can change nitrates in foods into nitrites or nitric oxide. Though the differences were small, they were statistically significant. And that's the health news from the People's Pharmacy this week.
Welcome to the People's Pharmacy. I'm Joe Graydon.
And I'm Terry Graydon. Almost everyone has had a headache from time to time. Most go away quickly with an over-the-counter pain reliever like acetaminophen, aspirin, ibuprofen, or naproxen. But some people get severe headaches that may last for hours or even days. They can be incapacitating. The medications that have been developed for migraines work well for many, but not for everyone. What can be done?
To help us answer that question and clear up other headache mysteries, we turn to Dr. Jennifer Kriegler. She's director of the Headache Medicine Fellowship at the Cleveland Clinic. She belongs to the Center for Neurorestoration and the Headache Section of the Neurological Institute in the Department of Neurology of the Cleveland Clinic.
Welcome to the People's Pharmacy, Dr. Jennifer Kriegler.
Thank you. It's nice to be here.
It's nice to have you with us on the People's Pharmacy. Dr. Kriegler, it's my understanding that if your brain surgeon colleagues were to go into the brain and do things, that for the most part, the patients don't have to be under general anesthesia. And the reason is that it doesn't hurt to have someone operate on the brain. And yet, the head is one of the most common sites of pain in the body. Can you explain that seeming paradox?
Yes, actually, it's really quite simple. The brain itself is insensate. In other words, it doesn't feel pain. But what is painful are all of the structures around the brain, the blood vessels, the covering of the brain, the meninges, those things that protect the brain, and the skull itself. And so it is the other structures, the blood vessels, the covering of the brain, the skull itself, that actually are what is causing the pain.
Now, most people are familiar with the idea of headaches, and some of us have heard that there are several different types of headaches. What are the main types of headaches, and what's behind each of them?
Oh, boy, that's a long question. There are what we call primary headache disorders, and there are what we call secondary headache disorders. And what you're referring to are the primary headache disorders. These are things like tension-type headaches, migraine, and things like cluster headache. So there are a number of different types of headache. They all share a similar, what we call pathophysiology, but there are some very distinct differences in how they present themselves. Tension-type headache is the most common type of headache. We rarely see that in the office because, for the most part, people can take an over-the-counter analgesic and their headache will get better. Migraine, however, and so tension-type headache, let me just go back and explain, is really a mild to moderate headache. it's featureless. In other words, it's not associated with other symptoms like nausea or vomiting. People can go about their usual activities.
Dr. Kriegler, I'd like to go back to this concept of tension headaches because I think everybody's sort of familiar with it. We've seen commercials for this problem and all kinds of drug treatments from, over-the-counter drugs like aspirin and Advil and Motrin and Aleve. But what causes a tension headache? I mean, we all know what it's like to be under stress. You're in traffic, you're late to an appointment, you've got a terrible business meeting. There are all sorts of things that in theory could lead to a tension headache, but what goes on in the brain when there's a tension headache, and why does aspirin work so well?
So basically, most headache pain is related to inflammation, and aspirin is a very good anti-inflammatory. Tension-type headache isn't due to stress, although if you are prone, stress can help provoke a tension-type headache. And so the name is a little bit of a misnomer in that it's not related to tension around the neck or the muscles, but people do feel like their neck and their skull is tense, and that's due to contraction of the muscles, but not the cause. So the cause is, there's an area of our brain that we refer to as the headache generator. And that area of the brain supplies pain and sensation to the entire head, neck, face, and shoulders. And so oftentimes when we're under stress, we're not sleeping well, that area of the brain can misfire. And it can send signals that will cause the muscles to contract, and hence you will get a headache.
Okay, so I interrupted you. You were moving on to migraines, and
right.
I suspect that there are some people who react to stress by getting a migraine, but in other cases they can be doing their normal stuff, and all of a sudden, out of the blue, boom, they're hit by a migraine.
That is correct. And migraine, again, in the area of the brain that we call the headache generator. In somebody who has migraine, you are genetically pre-programmed for that area of the brain to be a little bit more sensitive to stimuli. So this can be external stimuli like a strong odor, like weather changes. It can be due to an internal trigger like a woman's menstrual cycle, stress, which is a combination of both external and internal, different foods, and that can cause that area of the brain to start releasing chemicals. And these chemicals cause blood vessels to become leaky, and it causes what we call an inflammatory soup. And so there's an inflammation around the blood vessels and around the coverings of the brain, and that causes the pain.
Dr. Kriegler, you've referred to the headache generator, and you've said that it's located in a specific area of the brain. Without hopefully getting too technical about neuroanatomy, can you tell us what part of the brain it's in?
Okay. It's located in what we call the pons, and it runs from the top of the pons all the way down into the first 4 or 5 segments of the upper cervical spinal cord. Now, the brain is composed of the thinking part of the brain. That's what we refer to as the cerebral hemispheres. And then there's what we call the brainstem, which is the command center of the brain. And the pons is part of the command center, and this is responsible for all of the involuntary things that we do. Breathing, blinking our eyes, nothing that requires you to think, I'm going to do such and such, but all of those underlying activities that make our bodies work. And so that's the part of the brain that is affected.
Now, you mentioned the third kind of headache, cluster headaches. What makes them different from tension headaches and migraines?
So let me tell you what a migraine is, although people think they know what it is. But migraine is really defined as an episodic headache that lasts anywhere from 4 to 72 hours and is associated with any two of the following four. It's one-sided, throbbing, worsened with ordinary movement, and is always moderate or severe. It's never mild. And any one of the following two, light and noise sensitivity, nausea, or vomiting. So it is a significant headache because it affects a lot of different things, and people can't really work through them. So we always refer to migraine as more than just a headache. There are all these other things that occur. Now, cluster headache and what we call the trigeminal autonomic cephalalgias, or TACs, are a totally different type of headache. And these are typically located in and around an eye. They're short-lived as opposed to migraine. They last, minutes to up to 3 hours, and then they go away, and then they come back. And these are associated with our circadian rhythms. So people who have cluster headache are afraid to go to sleep because about 2 hours after falling asleep, they get this terrible headache. Now, fortunately, these headaches don't occur all the time. There's an unusual form of cluster headache which never really goes away. But by and large, most people will have them in what we call clusters. So they're tied to circadian rhythm, and so they're common at the equinoxes in the spring and fall. They're common around the time changes. And these are related to a problem in the middle of our brain involving the hypothalamus and the pituitary. So again, the pathophysiology is a little bit different. These headaches may occur anywhere from 1 to 8 times in a day, and they last for 6 weeks to 3 months and go away. They're very, very severe, and these are what we call suicide headaches.
You're listening to Dr. Jennifer Kriegler of the Cleveland Clinic, where she's on the staff of the Center for Headache and Pain and the Center for Neurological Restoration in the Department of Neurology. She directs the Headache Medicine Fellowship at the Cleveland Clinic.
The idea of suicide headaches, wow. I mean, we've heard from a number of health professionals and people who suffer from these kinds of headaches that they are just brutal. And they affect men more than women, whereas migraines
tend to affect women more than men.
This idea of a headache generator that causes blood vessels to become leaky and create a chemical soup sounds like inflammation.
Well, Dr. Kriegler did say that inflammation is very much involved in the generation of a migraine.
So it's a little bit like leaky gut for people who have digestive tract problems, except it's leaky brain.
Yes, and we don't want any of those things to leak.
We don't. After the break, we'll learn more about cluster headaches and how they can be prevented.
Have you ever tried inducing an ice cream headache to stop a migraine?
Taking pain relievers too often could lead to rebound headaches that can be really hard to treat.
You'll find out what other medicines can be used to treat and prevent migraines.
Are there supplements that can be helpful against migraines?
You're listening to The People's Pharmacy with Joe and Terry Graydon.
If you like the information you hear when you listen to The People's Pharmacy, you may also enjoy our book published by National Geographic. It's The People's Pharmacy Quick and Handy Home Remedies, available online at peoplespharmacy.com or at your favorite bookstore.
Welcome back to The People's Pharmacy. I'm Terry Graydon.
And I'm Joe Graydon. The People's Pharmacy is brought to you in part by Redx Industries, makers of utterly smooth creams and lotions that deeply moisturize to make dry skin feel soft and smooth. The number is 800-345-7339. The website is uttercream.com.
If you would like to purchase a CD of this show, you can call 800-732-2334. This is show number 1055. The number again, 800-732-2334, or you can find it online at peoplespharmacy.com.
Our topic today is headaches. People who suffer severe head pain have a hard time functioning when an attack is going on. Working and socializing are next to impossible. That's why it's easy to get caught up in a vicious cycle of taking pain relievers that can lead to rebound headaches. Is it possible to get out of this trap?
Our guest is Dr. Jennifer Kriegler of the Cleveland Clinic, where she's on the staff of the Center for Headache and Pain in the Department of Neurology. She directs the Headache Medicine Fellowship.
Dr. Kriegler, you just talked about what you refer to as suicide headaches or cluster headaches for some people who have them in a long string that they can repeat every couple of hours for not just days but for weeks. And we once were told by a neurologist that he had a patient whose cluster headaches were so bad that he would rub his head on the carpet so much that he developed rug burn. And another patient who actually banged his head on a heater, one of those old-fashioned radiators. And it's hard for us to imagine pain of that nature. Could you give us some sense of what you see when you have a patient who has cluster headaches and how they deal with it?
This is a very challenging type of headache. Most people who have it have a strategy developed to be able to deal with it until we can get it under control. Now, you're correct. People who have cluster headaches will bang their head. I've had people bang their head on the wall. I have patients who put their fists through the wall. I have a patient who, the last time I saw him came in, his arm was a cast. He broke his hand because he was trying to control the pain. They pace, they're not comfortable, they don't want to sit down. So it's a pretty horrible pain. And to kind of give you an idea of sort of how bad it might be, if you've ever had an ice cream headache where it's that sudden severe pain in your eye which takes your breath away, that's what it feels like, but it lasts not for seconds. It lasts for sometimes up to 3 hours and then goes away. So it's horrifying. So typically we try and have a strategy for treatment for the patient. Sometimes people have frequent enough clusters that they're always on some sort of baseline medication, but they know right away what to do to try and help themselves until they can get in to see us.
Are there preventive measures that people can take?
Yeah, so one of the most commonly used medications is what we call a calcium channel blocker, or verapamil, and it's most commonly used for blood pressure. And many people will use that if they have it on a regular basis. Now they'll have that and they'll keep it on board, and then when the headache starts, then we'll add in some other things if we have to. Oxygen is a great way to try and abort these headaches, and so many of these people will keep an oxygen tank at home, and if it should start, then they start breathing oxygen, and that typically will make the headache improve and get better. Oftentimes we need to give other types of medications, injectable medicines that can stop the pain. So there's a number of different approaches.
Well, we'd like to talk in a moment about medications and drill a little deeper, but you talked a moment ago about the ice cream headache.
Yeah.
And you're going to laugh at us. And we apologize for this because we have absolutely no science that we're aware of to support it. But we have heard now from a great many people who say, when I first come down with a migraine, if I drink a Frappuccino, from Starbucks, that has a little caffeine in it and it's really cold, or if I eat ice cream really fast, or even just drink really cold ice water, it can sometimes stop a migraine before it gets a hold on me.
And the idea is that by triggering the ice cream headache or the brain freeze, that somehow derails the migraine. This seems to work for a lot of people, but what we have is testimonials. We don't have research.
Any thoughts?
Well, what I can say is that some people do, first of all, caffeine we do know can help. Too much is no good, and, because that can cause headaches. But caffeine itself can cause some constriction of the blood vessels, and that can help with the pain. But the idea of derailing a headache is not, is actually a strategy that we'll use in the office, because if you can block the pain anywhere along the feedback loop. So typically we have pain. It sends a signal to our brain. We feel the pain, and it sends another signal back down that says, stop hurting. So if anywhere along the way you can derail the pain and you stop it for any period of time, oftentimes that can abort a headache. Now, I've never heard of anybody doing it with something very cold. Most people will say that something really cold when they have a headache will temporarily help their pain. Some don't like it and they feel it makes it worse. But again, if you've figured out a strategy that can derail it, that's wonderful.
Well, I'll never forget, we had a visitor who was a researcher at one of the major drug companies, very highly respected. And he was coming down with a migraine, and he said, I didn't bring my Imitrex, my sumatriptan with me. Do you have any? Well, we don't suffer from migraines, so we didn't have any Imitrex, and we wouldn't give it to him even if we did. He is a physician. And we said, but why don't you try this crazy home remedy of ours? And he looked at us like we were totally, out in left field someplace. We said, well, here, we have a bowl of ice cream. Eat this ice cream really, really fast and see if you can induce brain freeze. So he did it, and to his astonishment, the migraine went away. And he reported back a couple of days later, and he said, when I get a migraine, it usually lasts for at least 2 days. I'm completely headache-free, and I don't have a good explanation for it other than this silly home remedy of yours. Now, again, it's an anecdote, but we just wanted to share that with you. Maybe sometime you could try it and let us know if it works in any of your patients.
I was just going to tell you that the next time I get a migraine, I'm going to try it because I love ice cream. And what a better way to treat my headache than to eat something that I like.
Well, exactly. Dr. Kreeler, we'd like to ask you about a difficult situation that some people get themselves into, which is they may have headaches often enough that they're taking headache medication too frequently. And then when they stop taking the headache medication, they get a rebound headache. Can you talk to us, please, about rebound headaches?
Yes, actually, it's one of the more common problems that we have in the headache center. And, sometimes it's through no fault of the person themselves. If you have never had migraine or a relative, a close personal relative who has migraine, because in that instance, you're a little bit more genetically pre-programmed to this. But say you've never had migraine, you can take a boatload of any of these over-the-counter analgesics or prescription analgesics and never give yourself a headache. But if you have migraine and you start using these medications too frequently, what happens is that every time it wears off, it's starting to cause the area of the brain, the headache generator, to misfire again. And pretty soon, that area is now way more sensitive to anything, to any kind of input, so that you use something and as soon as it starts going away, because it is super sensitized, it keeps misfiring. And so it's a big problem. And oftentimes it's not the individual themselves, they're just using it, but they may have headaches that are very well controlled, and then they have some sort of orthopedic surgery, a knee surgery, they have dental surgery, they're taking analgesics for a period of time for that to try and, get better, and then all of a sudden we get phone calls saying, oh, I'm having a headache almost daily, and it's because of this. So what we've seen is that there's been some very, very good long-term epidemiological studies, and Marcelo Bigal was the lead author in this, and he looked at over 17,000 individuals in a data bank. And it turns out that if you are using medications any more than 8 to 10 days out of a month, you can get what we call rebound headache or medication overuse headache. And there are some medicines that make it occur faster than others. So if you were to use just over-the-counter medicines like NSAIDs, 10 days or 12 days of that a month can cause you to have medication overuse. If you are using opiates, 8 days a month of something like codeine or Vicodin can cause you to get it. If you're using triptans, 10 days a month. If you're using a medication called Furosec, which is we rarely use in headache, just 5 days a month can cause somebody to get migraine. And any combination of those 10 days a month or more can cause you to get an overuse headache. So we do know that if somebody's having frequent headache, we want to give them something to try and prevent their headaches from occurring. And unfortunately, that is a little bit of a misnomer in that when we talk about giving preventative medications to people, we don't necessarily mean that they're never going to have a headache. The goal of good prevention is a 50% decrease in the intensity and frequency of someone's migraine, and then if they get one, to allow their rescue medicines to work better.
Now, Dr. Kreeler, I'm sure that there are a lot of people who get into the habit of using those over-the-counter medications because some of them even have migraine on their label. So Advil, Motrin IB, ibuprofen, generic house brand, aspirin, acetaminophen, Tylenol. And let's just say they're using these drugs every day, maybe a couple of times a day for weeks on end, and then they stop. And then, boom, they get hit by a rebound headache. Now they want to start taking them again to make the headache go away. How do you deal with those rebound headaches?
So they can be very challenging. People can cold turkey it. I don't usually recommend it, just stopping it. But if you stop it, within 3-4 days, your headache is going to get better. So there are some strategies that we can do. We can give somebody a course of steroid or prednisone for a week to 10 days, and that can help decrease and keep the headache at bay for that amount of time while they're stopping their medication, and then we would institute a preventative medication. The theory is that it doesn't do a whole lot of good just to get somebody off medications, but then what you have to do is be able to keep the headache away, and you have to be able to keep it away by instituting another medication.
What types of other medications do you use for prevention?
So there are a number. There's really 4 main groups of medications that we can use. One are some of the blood pressure medicines, things like beta blockers, propranolol, nadolol. Verapamil sometimes can be used. Candesartan, which is an ARB, can also be used. There are the anticonvulsants, topiramate and valproate. They can have some side effects, and you have to be careful in a woman of childbearing age because they are pregnancy Schedule D. You can't take them during pregnancy. And we do know that 50% of all pregnancies are unplanned. So unless someone's using birth control, you have to be very careful about using them. There are a few other anticonvulsants that can be useful. There are some of the antidepressants, and these are typically either the tricyclic antidepressants like amitriptyline or nortriptyline, or what we call the SNRIs, or the serotonin and norepinephrine reuptake inhibitors. And these work for pain. These are medications like duloxetine, which is Cymbalta, or desvenlafaxine, which is Pristiq, or venlafaxine. And it's the norepinephrine component that can really make a difference. And then lastly, something that I always like people to start on in terms of medications, and they're really not, but they're supplements. So there are certain supplements that are very useful. Magnesium, coenzyme Q10, B2, feverfew. So there's a number of supplements that can be useful. The biggest problem with supplements is that it may take up to 3 months for them to really become effective, but they do work very, very well. And then it's a whole series of lifestyle changes. So for me, the most important thing that I can do for somebody who comes in who's having rebound or who's having migraine is to sit down with them and discuss about keeping a diary, identifying your triggers, trying to avoid them, getting adequate exercise, not getting dehydrated, getting proper sleep. Don't sleep too long. Don't, get enough sleep. Things like that do meditation, that all can be very, very helpful in terms of managing headache. And if you can identify your triggers, you certainly are, and avoid them, you're certainly going to be far better off because you'll be taking less medicine.
You're listening to Dr. Jennifer Kriegler, Director of the Headache Medicine Fellowship at the Cleveland Clinic. She belongs to the Center for Neurorestoration and the Headache Section of the Neurological Institute in the Department of Neurology of the Cleveland Clinic.
It's nice to hear Dr. Kriegler mention some non-drug approaches. This is not the first time we've heard that magnesium can help prevent headaches, and in particular migraines, but there were some other things she mentioned too.
Well, feverfew, which is an herb, and vitamin B2, riboflavin, we have heard that one before. I had not heard that coenzyme Q10 could be helpful in preventing migraine headaches.
And we've heard it's useful for people taking statins, but maybe also for people with headaches. We need to take a short break. When we come back, we'll find out what triggers a headache or a migraine.
What about menstrual migraines or headaches triggered by strong fragrances or perfume?
What is a benign sex headache?
When headaches cause sleep problems or vice versa, what can people do?
Is acupuncture an option?
We've heard that ginger might help. What does it do? Are there other supplements that can be useful?
You'll also learn what's on the horizon for headache relief.
You're listening to The People's Pharmacy with Joe and Terry Graydon. If you're enjoying this People's Pharmacy podcast, why not head over to our website where you'll find a wealth of information on medications, conditions, home remedies, and ways to keep yourself healthy. You'll find it all at peoplespharmacy.com.
Welcome back to the People's Pharmacy. I'm Joe Graydon.
And I'm Terry Graydon. The People's Pharmacy is brought to you in part by Red-X Industries, makers of Utterly Smooth Foot Cream with shea butter, helping dry, cracked feet feel utterly soft and smooth. 800-345-7339. The website is uttercream.com.
To order a CD of today's show or any People's Pharmacy broadcast, you can call 800-732-2334. Today's show is 1055. That number again, 800-732-2334, online at peoplespharmacy.com.
Today we're discussing headache prevention and treatment. Not everyone responds to the triptan medicines that are commonly used for migraines. What else might be useful?
We're talking with Dr. Jennifer Kriegler. She's director of the Headache Medicine Fellowship at the Cleveland Clinic. She belongs to the Center for Neurorestoration and the Headache Section of the Neurological Institute in the Department of Neurology of the Cleveland Clinic.
Dr. Kriegler, what sorts of situations can trigger a headache, particularly a migraine?
So there are a lot of different things. Certain foods, chocolate, aged cheese, certain broad bean pods, sometimes ripe avocados, ripe bananas, things that have a high amount of tyramine in them. So those are some very common triggers. Wine is another one, and alcohol in general. In the red wines, it's tannins. In the white wines, it's usually sulfites. So we want people to, when you're thinking about eating, you don't want to eat things that have a lot of preservatives. You want to eat natural food that's whole food. You want to be able to avoid artificial sweeteners. You want to avoid preservatives. Stress, we've talked about, can be a trigger. Weather changes is a big one. It's not an old wives' tale that when the weather front comes in and the weather barometric pressure drops precipitously, somebody gets a migraine. Dehydration is another very common one.
Dr. Kriegler, I know a lot of women who have had menstrual migraines. Can you tell us a bit about that, please?
Oh, yes. Menstrual migraine is a very common thing in many women. It has to do with the fall in estrogen. So there was a very nice study done in 1971 by Somerville, and he looked at that very issue. Progesterone doesn't seem to have a role in it, but it's the fall in estrogen. So common times for women to get migraine are at ovulation and at the time of their menstrual cycle, a day or so before, up to 3 days into it, and that's when the estrogen falls dramatically. The other common time is for migraine to get out of control is at perimenopause, when you have a lot of hormonal fluctuations.
What about perfume? I've heard that there are some people, when they are exposed to strong fragrance, that might be a trigger.
That's a huge trigger. And it's typically very strong smells or a lot of intense floral smells, like intense roses and things like that. That's a very, very common trigger. We always ask our patients not to come in wearing perfume. You'll be surprised at how many do. So it's a challenge.
There's another kind of headache. It's referred to as a benign headache, although I think that when people experience it, they don't think of it as very benign, and that's called a benign sex headache. What's that about?
Oh, yes. And that actually, the first time it happens, needs to be evaluated because typically it is a sudden severe onset of a headache. It is more common in men than it is in women. It can occur in the pre-orgasmic phase, but most commonly occurs at orgasm, and the person's fine, and all of a sudden they feel like they've been hit over the head with a baseball bat. And of course, we worry that someone's had an intracranial hemorrhage or a bleed, and so they need to be evaluated. But once that's excluded, then it's what we call a primary sexual headache. And again, it's easy to treat if you can identify it. It's what we call an indomethacin responsive headache, and you can take indomethacin an hour before you want to have intercourse, so that doesn't happen.
So indomethacin, it's a prescription pain reliever
yes,
and NSAID.
Uh-huh. Yes.
Dr. Kriegler, moving on to another trigger, you mentioned that sleep or inadequate sleep or too much sleep or just sleep difficulties can be a problem for headaches. Could you tell us why that's so important, and is there anything that people can do? I know that sleeping pills are very popular these days, especially those PM sleeping pills that contain diphenhydramine. Is that a good solution?
No, those aren't really good solutions. First of all, if somebody's not sleeping, we want to know why it is. So they might have a problem with sleep apnea or some other primary sleep disorder. So I always recommend that somebody get a sleep study if their sleep is very disturbed, because you want to be able to treat the primary problem easily. If it's a matter that somebody can't turn off the day, or they'll awaken because they're, going to the bathroom a lot, typically we like them to learn to do some relaxation techniques, use white noise, things that will allow them to kind of, take their mind off the day. And lastly, if somebody does have a significant sleep problem, and it's very common around the time of menopause for women, we don't want to use things like, the Zolpidem or Ambien or those kinds of things. They're not meant for long-term use, and they can disturb the natural sleep cycle. So one medicine that we actually typically will recommend is a medication called trazodone, which is an old antidepressant, not really used as an antidepressant anymore because it doesn't work very well. But it works extremely well for sleep, and one of the nice things about it, it doesn't disturb the normal sleep architecture. So it shortens the time to the onset of sleep, typically by 7 minutes or so. People will fall asleep very quickly, and then they go through the normal sleep stages, including stage 3 and stage 4 and REM sleep, which are the restorative sleeps. And we find that people who don't sleep well don't get into that deep sleep. So that would be important. But I'd only want to do that if I've excluded that they don't have a problem with sleep apnea or something that should be treated in a different way.
Dr. Kreidler, the holiday season is sometimes headache season for people. Why would holidays trigger more headaches?
Well, there are a number of things. First of all, one of the most common causes of headache is what we refer to as the Yom Kippur headache for the Jewish folks, and for some of the Muslims, at the time of Ramadan and fasting, they get it because they're not eating, they're getting dehydrated, they're not eating, so that's a common cause. But if you're looking at things like Thanksgiving and Christmas, there's a lot of factors that can go into it. People don't eat the same. They don't drink the same. They stay up later. They're oftentimes put in situations that they don't particularly want to be in. There's unusual smells around. A lot of people are having, all of these scents for the holidays. So those are a lot of different things. Migraineurs need to keep a regular schedule. When they fall out of their normal schedule, their headaches get worse. And so typically I'll tell people to be aware of some of these things. And if they're really having a significant problem, I never change medication during the holiday season because honestly, usually when that's over with, the headaches get better.
Well, once the holidays are over and you've got bills to pay and the family has finally gone home and you're in that recovery phase, we've heard that people may develop stress relief headaches. Why and how do those headaches differ from, the pre-holiday stress headaches?
So many people will go through a very stressful time and handle it very well. If there's a significant illness in a family or a death in a family or even a wedding or something joyful, it's a stressful event typically. And so they get through that, and as soon as they let down, then the headache occurs. It's a very interesting paradox. It's also very common for people to get a headache the very first day or two of vacation, where they kind of just are letting go, and then their brain kind of goes haywire.
Dr. Kreidler, we've discussed a few of the medications that people might use. I wonder if you have non-drug approaches that you recommend to some of your patients.
Well, exercise is important. 30 minutes of walking, perfect. Learning some biofeedback. Yoga is an excellent exercise for people. It can help just get them, de-stress, make their minds and their bodies relax. So those are some really wonderful things. Learning any kind of cognitive behavioral therapy, learning biofeedback, learning mindfulness. Those can be extremely useful techniques for people. And it doesn't have to be expensive. There's some very nice apps that are available for people's smartphones or their iPads, which can teach them how to do deep breathing that can take them into a very calm state. And so these are the things that I typically will recommend to folks.
What about acupuncture?
So acupuncture is very interesting. Years ago, I used to do acupuncture, and I just don't have the time to do it now. It works best probably for someone who has a headache that is currently ongoing and can be pretty amazing. It is a preventative, it's a challenge because you have to keep doing it. You can't just do it once, so you have to keep doing it, but it's a wonderful way of trying to manage your headaches.
Now, you've suggested that perhaps you suffer from headaches yourself?
Yes, I do.
So here you are, one of the country's leading headache experts, also very empathetic with your patients because you've been down this road yourself.
I have been down the road, that is for sure.
Any magic bullets that work for you that our listeners would be interested in?
I try and eat as naturally as possible. I try not to eat processed foods. I keep myself hydrated. I typically always have some water with me. I try and avoid, artificial colors and flavors and things like that. I exercise routinely. I always take a little bit of time for myself every day to kind of put myself in a meditative state. I learned that a long time ago to help try and, just manage my stress. So I'll do those sorts of things. And I found that, those are things that can be really beneficial.
What about ginger tea or something of that nature? Is there anything like that that helps?
Well, ginger tea is very useful if you have a lot of nausea associated with your headache. It doesn't really do anything for the headache itself, but nausea is, if it's prominent, ginger tea is wonderful.
Now, you are also interested in natural remedies and supplements, and I'd be curious about magnesium, because here's a mineral that a great many people are deficient in large measure because, well, the medications they're taking, the diuretics, tens of millions of Americans are relying on diuretics, and they may not even realize that their blood pressure pill has a diuretic included with it. And a lot of the common thiazide diuretics, hydrochlorothiazide being, of course, the classic, but many others are out there as well, can deplete the body of magnesium, and people might not even realize that they were low. Why would magnesium be so helpful for migraines?
Well, magnesium really helps regulate muscle and is very important in terms of helping to stabilize the muscle membrane around the blood vessels. It is really wonderful for normal function of nerves and muscles. So it really does help restore that. One of the other bonuses for magnesium, if somebody's using it for their migraine, is that they typically, if they're constipated, they'll be regular for the first time in their life. And they've never realized that it's because they've been magnesium deficient.
Dr. Kriegler, what's on the horizon for headache relief?
Oh, there's some really great things that are on the horizon. These are what we call CGRP or calcitonin gene-related peptide. These are monoclonal antibodies that are developed that either block the release of the CGRP, so it's the monoclonal antibody is to the CGRP or to the receptor, And these drugs work spectacularly to prevent headache.
Dr. Kriegler, could you tell us a little bit more about these new medications for headaches? How soon can we expect them in our pharmacies?
Probably not for 2 to 3 years. We're finishing the phase 3 trials on them now. They really look extremely good. But you know that there's always a lag between when the phase 3 trials are done and then when, the FDA will approve them. My biggest concern, quite frankly, with relationship to these medications is that I'm hoping that the cost isn't going to be out of sight so that people will be able to take advantage.
So do you think they'll be revolutionary for the treatment of migraines?
Oh, I think so. Absolutely. I think they're going to really change the whole face of what we're doing here, much the way they've done with MS and other diseases.
Dr. Jennifer Kriegler, we want to thank you so much for talking with us on the People's Pharmacy today.
It's been my pleasure. Thank you.
You've been listening to Dr. Jennifer Kriegler, Director of the Headache Medicine Fellowship at the Cleveland Clinic. She belongs to the Center for Neurorestoration and the Headache Section of the Neurological Institute in the Department of Neurology of the Cleveland Clinic.
Lynn Siegel produced today's show. Al Wadarsky and David Tripp are the engineers. Dave Graydon edits our interviews. The People's Pharmacy is produced at the studios of North Carolina Public Radio, WUNC. The People's Pharmacy theme music is by B.J. Lederman. The People's Pharmacy is made possible in part by Redx Industries, makers of Utterly Smooth Extra Care 20 Cream with 20% urea for extra skin protection. The number is 800-345-7339. The website is uttercream.com. If you would like to purchase a CD of today's show or any other People's Pharmacy broadcast, you can call 800-732-2334. Today's show is number 1055. That number again is 800-732-2334, or you can place your order online at peoplespharmacy.com. When you visit our site, you can check out information on prescription drugs, herbal medicines, and home remedies. Share your thoughts on today's show. What have you found helpful for headaches? Have you ever tried a home remedy, such as ice cream to induce brain freeze, or perhaps spicy gumbo soup? Or, well, what have you tried? What has worked and what has failed you? We'd like to hear from you. At our website, you could also sign up for our free online newsletter or the free podcast of the show. You can listen at your own convenience. You can even share it with a friend. It's all there at peoplespharmacy.com. In Durham, North Carolina, I'm Joe Graydon. And I'm Terry Graydon. Thanks very much for listening, and please do join us again next week. We hope you enjoyed this podcast. If so, please consider taking a minute to write a review on iTunes. And thanks for listening to The People's Pharmacy.